The Philippines has had one of the longest and harshest COVID lockdowns in the world. On Good Friday this year, millions of the country's Catholics had to stay home. But despite these measures, the country surpassed 1 million COVID-19 cases, with over 16,000 deaths on April 26. Physician Ivan Zapanta, who works at a private hospital in Makati City, Metro Manila, has been forced to make some difficult decisions.
We can't save everyone. We need to save who can be saved. We had to evaluate which of the patients currently lined up for a bed will benefit the most, who will survive the most.
Zapanta is also seeing more younger Filipinos needing hospital stays.
And surprisingly, they're the ones who's needing oxygen support and even intubation and intensive care.
Many blame a lackluster effort by the government for the delayed procurement of vaccines and favoring opening up businesses over enhanced contact tracing and more support for the healthcare sector. As a result, hospitals were unprepared to accommodate an influx of cases. Over 1 million people have been vaccinated since March, only around 1% of the population. All this while the government faces widespread vaccine hesitancy. President Rodrigo Duterte, who was absent from the public eye at the onset of the surge, has since said that the government did not fall short in its response. Jason Maulit watched his great-grandmother and later his grandmother die from COVID-19 complications.
We heard stories of people dying in tents, people who died because they couldn't make it to emergency rooms. So both the doctors in the family, tried to diagnose it and said na parang better if we do home care.
Jason's great-grandmother died in an emergency room. She passed away after the family called more than a dozen hospitals, all full. Oscar, who asked his last name to be withheld, is an ambulance driver in Manila.
Last year, if you have a patient, you can still bring them to the hospital and they would have space. Unlike this year, most of them have signboards outside their hospitals, their driveways, saying we're full capacity for COVID-19 patients. What we have been experiencing these past days, we don't have a place, we don't have a hospital to bring them to. That's the problem.
And when people are able to find the hospital, it is usually in overcrowded COVID wards like this public hospital in Makati City. The Philippine government is rushing to open new facilities, but for many, like Maulit and his family, it's already too late.